Good afternoon. I'm Dr. David Rodbard. I'm an endocrinologist and a specialist in diabetes. We're very fortunate here today that the American Diversity Group is sponsoring this program, and we're fortunate to have with us Dr. Helena Rodbard, who is also an endocrinologist and specialist in diabetes, who has been practicing in Montgomery County for the past 30 years. She's a specialist in diabetes and has been engaged in both clinical practice and medical research, both at NIH and more recently in her private practice in her office. Dr. Rodbard is the former president of the American College of Endocrinology, and she's been very active in all of the national and international organizations involved in clinical research in diabetes. Dr. Rodbard, tell us about the issues and problems of diabetes in the community right here in Montgomery County that we face today.
Thank you very much for your very kind introduction. It's my pleasure to be here and speak with you today about a condition that has assumed epidemic proportions worldwide, including in our community. Diabetes has affected over 30 million people in our country. Many of those people that have diabetes don't even know that they have the condition. And it's absolutely critical to diagnose and treat people with diabetes appropriately in order to reduce the long-term complications of the disease. Nowadays, we have a plethora of different forms of treatment, lots and lots of new medications and forms of treatment that can really prevent the so dreaded complications of diabetes and allow people to have better quality of life.
Dr. Rodbard, who are the people who are at greatest risk to develop diabetes?
The people at greatest risk of developing diabetes are minority populations, specifically African American populations, Hispanic populations, other people in our community, such as Asian people, people of Asian origin, such as people from India, from Bangladesh, people from Indonesia, Malaysia. All of those people are at higher risk for developing diabetes.
What are the other factors that might lead to an increased risk of diabetes? Things like age, and what other things might be responsible?
In addition to genetic and ethnic factors that are related to the increased incidence of diabetes, age is one of them, but also obesity. People that are overweight or obese are disproportionately affected by diabetes.
What kind of treatments are available nowadays for people with diabetes? Is it pills or injections or something else?
There are many different forms of treatment for diabetes, and we are very fortunate to have so much to offer to our patients, allowing them to lead perfectly normal lives as long as they are properly treated and bring their diabetes under good control. We, in our practice, we are conducting clinical trials. Those are basically studies that are sponsored by pharmaceutical companies, and that enables us to provide care free of charge to our patients that qualify for the clinical trials. Not only do they get, but I would like to think, the best possible medical care provided by board-certified endocrinologists, but they also get free medications and free testing as long as they qualify for the trial and for the duration of the trial.
What is a typical length of a trial?
Depending on the trial, It can range anywhere from 6 months up to 5 years. And many of our patients, and we've been conducting clinical trials for a couple of decades, many of our patients, once they terminate one of the clinical trials, they frequently ask us whether we have another trial that they could participate. So we have the patients that just keep coming back. They go from one trial to the other, which I believe is a testimony to their satisfaction with the reports and the results of what is happening to their health.
Why is it so important that people get their diabetes diagnosed and then treated, and treating it to the proper target level, as opposed to just sort of going along with it and not worrying about it?
People who have their diabetes under good control can lead normal lives within certain limits. Of course, there are the dietary restrictions, which, by the way, we all should be following a healthy diet with eliminating sweets, eliminating junk food. We all should be eating properly. But the concern with uncontrolled diabetes is that people can develop the dreaded long-term consequences, such as they can develop blindness, they can develop kidney disease, sometimes even needing dialysis or kidney transplants. It can also lead to amputations of the feet and legs, and all of those conditions are preventable. In addition, people can also develop what we call macrovascular complications, which are heart attacks and strokes.
Nowadays, we have something else we have to worry about. People with diabetes have a much higher risk in the event that they develop COVID. And so it's wonderful that the American Diversity Group is doing COVID testing and hopefully before long doing vaccinations as well right here in Silver Spring in Montgomery County. So that's another very important factor for everybody to consider.
People with diabetes are at a higher risk of developing COVID, partly because of the condition of diabetes itself, but also because it tends to affect disproportionately people that are overweight or obese. So that's another risk factor and another reason why we should treat people with diabetes to goals, to the hemoglobin A1C goal, which is the measure of the long-term control of diabetes. And also there is a new concept now, which is time in range, which means that the blood glucose level needs to be within a good range throughout the 24 hours of the day.
Dr. Rodbard, I understand that some of the newest and best medications for diabetes actually help people lose weight, for those who need to lose weight.
Yes, some of the newer medications for diabetes actually help to lose weight as well. So they work as appetite suppressants, and they have some other mechanisms of action by which people, in addition to getting their blood glucose controlled, they also have the benefit of losing weight appropriately.
Well, once again, we'd like to thank the American Diversity Group for hosting this session today, and we hope that many people in the community will take advantage of the very special services provided by American Diversity Group, which includes not only matters related to diabetes, but to other health conditions, including COVID testing and perhaps before too long COVID vaccinations as well.
And I also wish to extend my appreciation to the American Diversity Group for hosting this program and giving us the opportunity to discuss the concerns with diabetes and how much that can be done for people that are affected by diabetes. Thank you all so much for your attention.